What is the trauma of forced displacement? Have you ever thought about what happens when people are forced to leave their homes? The trauma of forced displacement is a serious issue that affects many individuals and communities around the world. This term refers to the involuntary movement of people due to conflict, persecution, or natural disasters. It can lead to significant emotional and psychological distress. When people are displaced, they often experience a loss of their homes and belongings. This loss can lead to feelings of anxiety, depression, and even post-traumatic stress disorder. The psychological impact of such events can be long-lasting. Individuals may struggle to cope with stress and maintain their emotional well-being after experiencing forced displacement. Another important aspect is the disruption of social networks. When people are forced to move, they often leave behind family, friends, and community support systems. This can create feelings of loneliness and isolation. Medical anthropologists study how these changes affect mental health and resilience. They look at how social connections can help individuals cope with their new realities. Cultural practices also play a significant role in how people deal with trauma. Displacement can lead to the loss of cultural traditions and social structures. However, many displaced individuals find ways to maintain their cultural identity and rebuild their communities. This resilience is an important area of study in anthropology. It shows how cultural continuity can support mental health recovery. In the field of medical anthropology, understanding the trauma of forced displacement is essential for creating effective mental health interventions. Anthropologists work with healthcare providers to develop culturally sensitive mental health services. These services aim to address the unique needs of displaced populations. They often include support for cultural practices and community rebuilding efforts. By looking at the trauma of forced displacement through an anthropological lens, researchers can better understand the relationship between cultural disruption, social change, and psychological distress. This understanding helps inform strategies to support the mental health and well-being of displaced individuals and communities. The trauma of forced displacement is a complex issue, but with the right support and understanding, individuals can find ways to heal and rebuild their lives.